The medication that I'll be administering today is enoxaparin. The generic name is Lovenox, and the class is an anticoagulant. The onset is unknown, the peak is 3 to 5 hours, the duration is 12 hours, and it is given for the prevention of thromboembolism, deep vein thrombosis, and pulmonary embolism. The contraindications include severe uncontrolled hypertension, bleeding disorders, and gastrointestinal bleeding. Some adverse reactions include dizziness, headache, insomnia, edema, urinary retention, or erythema at the injection site. Some nursing implications are to assess for signs of bleeding and hemorrhage, such as bruising and tarry stools. So, two medication policies that I also want to go over are that medications that are ordered between 2 and 6 times per day need to be given within 1 hour of the standard administration time. And enoxaparin is a high alert medication, so it requires an independent double check. So now I'm going to open the chart. So the patient's name today is Sid Garland. He is a 54-year-old male that has been admitted to the hospital for a below-the-knee amputation of his left leg. The patient has suffered from a gangrenous foot ulcer for the past year prior to his amputation. So the nurse's report states that he woke up complaining of nausea and vomited approximately 200 milliliters of emesis. He's pale and diaphoretic, and his vital signs were 37.5 degrees Celsius for his temperature. His heart rate was 100 beats per minute. His respiratory rate was 18. His blood pressure was 130/75, and his oxygen was 97% on room air. He reports his right calf pain is a 5 out of 10, and it remains slightly swollen and warm to the touch. He is continuing on anticoagulant therapy. So his lab values show that his prothrombin time is 1.45, which is flagged as low. And now I'm going to sign the chart. And now I'm going to compare the doctor's order to the MAR. So the patient's name is Sid Garland. The patient's name is Sid Garland. His medical record number is 344316. His medical record number is 344316. His date of birth is November 8th, 1965. His date of birth is November 8th, 1965. His allergies are penicillin and codeine, and his allergies are penicillin and codeine. The medication be administering is enoxaparin. Medication is enoxaparin. The dose is 1 milligram per kilogram. The dose is 1 milligram per kilogram. The route is subcutaneously. The frequency is every 12 hours. And the special directions include the patient is to be weighed weekly. The special instructions is the patient is to be weighed weekly. And I will be giving the 900-hour dose. So now I am going to perform hand hygiene and grab the correct medication. So the medication is enoxaparin, and it expires on September 2028. And now I'm going to complete the first check against the MAR with the medication bottle. So the patient's name is Sid Garland. His medical record number is 344316. 4316. His date of birth is November 8th, 1965. November 8th, 1965. His allergies are penicillin and codeine. The medication I'll be administering is enoxaparin. The dose ordered is 1 milligram per kilogram. The dose I'm given is, the medication that I'm given comes in 100 milligram per 1 milliliter. The route is subcutaneously, and this is a subcutaneous injection. The frequency is every 12 hours, and the special directions include to be weighed weekly, and the reason is for anticoagulant therapy. I will be giving the 900-hour dose. Now I'm immediately going to complete my second check. So the client's name is Sid Garland. The medical record number is 344316. His date of birth is November 8th, 1965. His allergies are penicillin and codeine. The medication is enoxaparin. The dose is 1 milligram per kilogram ordered. The medication I'm giving comes in 100 milligrams per 1 milliliter. The route is subcutaneously. The frequency is every 12 hours. This is a subcutaneous injection, and the frequency is every 12 hours. The special directions include to be weighed weekly, and the reason is for anticoagulant therapy, and I will be giving the 900-hour dose. Before giving the patient this medication, I would assess for any redness, swelling, or bruising at the site. And now I'm going to complete my calculation. And the patient's weight, according to the doctor's order, is 75 kilograms. Perform my calculation. So the amount of medication that I need to draw up is 0.75 milliliters. So now I'm going to draw up that. Using my blunt filled needle, I'm going to inject 0.75 milliliters of air first into the vial. Then I'm going to draw up just over the amount, 0.75, so I have enough to prime the injection needle. I'm just going to flick out any air bubbles. Then I'm going to recap with one hand. So I drew up just over 0.75. Then I'm going to switch over to the injection needle. And then I'm going to prime the needle up until the desired dose of 0.75 milliliters. And now I'm going to complete my third check with the medication bottle against the MAR. So the client's name is Sick Garland. Medical record number is 344316, 344316. His date of birth is November 8th, 1965. November 8th, 1965. His allergies are penicillin and codeine. The medication is enoxaparin. The dose ordered is 1 milligram per kilogram. The medication bottle comes in 100 milligram per milliliter. According to my calculation, I needed 75 milligrams, and then I needed to draw up 0.75 milliliters in my syringe. The route is subcutaneously, and this is a subcutaneous injection. The frequency is every 12 hours. The special directions include to be weighed weekly. I'm giving the 900-hour dose, and the reason is for anticoagulant therapy. So now I'm going to turn my card over and recheck my calculation. Double check my calculation, and at this point I would call my instructor over for a double check before I would go in and bring my medication into the room for my patient.